I recently sat down with a friend who was diagnosed with cholestasis during her pregnancy, and she didn't have a lot of information about it. She had never heard about it. And I was like, you know what? That means not very many people have heard about it, so we're gonna talk about it. I'm gonna make quick, short, easy videos to help you guys understand different conditions, whether it's in pregnancy or women's health or gynecology, periods, fibroids, whatever it may be. But I'm gonna simplify it so that you feel more empowered, more educated. You kind of know what to expect. You kind of know what it is, how we diagnose it, treatment. So let's get started. What is intrahepatic cholestasis of pregnancy? Also just called cholestasis or ICP for short. Cholestasis is going to be the most common liver condition that we see in pregnancy. Bile is a substance that's made in your liver. Your liver is right here on your right side. Bile travels down to the small intestine, and bile helps break down fats in our diet. Why is this relevant to cholestasis? Because in cholestasis of pregnancy, that flow of bile is blocked. Because that flow of bile is blocked, some components of bile are going to then be deposited on our skin. What do you think is going to be the most common symptom of cholestasis? You might be thinking rash. But one of the interesting things about cholestasis is there is no rash present. The most common symptom is going to be severe itching. I find even more interesting is that the severe itching is pretty much isolated to the palms of your hands and the soles of your feet. So severe itching in your hands and feet. Now for some people, that itching can extend to the trunk of the body, but primarily hands and feet, and itching is worse at night. So it's kind of interesting, right? Like you have all these like weird symptoms, but they all tie together and it's all associated with cholestasis. Remember, cholestasis can happen again in your next pregnancy. It just kind of depends. Check back in the next video because then we're going to talk about how we diagnose and treat cholestasis. Hey, love you guys. Bye. Never stop learning. Always feel empowered. Symptoms of cholestasis usually start around the third trimester, and they usually go away a couple days after you deliver.